Back now on America's Forum, J.D. Hayworth, John Bogman, Andy Tillis still here. Andy, we're continuing to talk about mental health and the military.
Absolutely. Following the Fort Hood shooting, the issue of mental health and military is back in the spotlight. An ongoing study in the Journal of JAMA, Psychiatric Journal, shows that military suicide rates continue to climb. The suicide rate more than doubled between 2004 and 2009, a period with some of the most intense fighting in Iraq and Afghanistan. But the alarming uptick wasn't just for soldiers overseas. The rate also climbed for those who never left the U.S., suggesting those with suicidal tendencies had them before they enlisted.
Well, when we hear this, and this amplifies an earlier discussion we had on this point, Andy. Look, we have an all volunteer military today, and we salute the work they do and the level of professionalism. I can tell you, as a former member of Congress, when one of my constituents was wounded, I went to see him at Walter Reed. He said, "Look, Congressman, get me back to active duty. I'm a Cav Scout. It's what I do for a living." So there is a sense of professionalism, but also demographically, when you're looking at young people, and it has ever been thus, one of the reasons I would conjecture a lot of young people aren't signing up for health insurance, there is a tendency to believe in one's immortality.
Of course.
So I don't know where the line develops between that illusion of immortality and, quote, suicidal tendencies.
I don't know that they're intertwined. I don't think that young men and women go into the Army or the military thinking that they're invincible. I do think that they go with a positive attitude that they're going to help the United States, and they want to win, and they want to keep us as the strongest power. However, they are not coming back to a hero's welcome that used to be anytime somebody went to war, they came back and it was cheering, and now they come back and their reward is that they get to go back again. They're actually going to be deployed again. So there really is no end in sight. How do you get excited about coming home when you know it's not over?
Well, right now we'd like to bring in Dr. Scott McFarland, who has a lot of experience working in emergency medical rooms, and not just necessarily with soldiers, but has often seen, as the case here in his Florida, the Baker Act, when somebody is, doesn't have the capacity to make decisions for themselves. Sometimes they have to be put into an institution or under someone's care. Dr. McFarland, it's good to have you with us.
Hey, I'm honored to be chosen. Thank you very much for calling.
Okay, so we're talking about mental health issues here, and as everybody knows, it's not necessarily a black and white issue. There's a lot of gray area here when it comes to, whether you make the diagnosis, whether you put somebody under the Baker Act, somebody who maybe needs to be institutionalized. Talk to us about some of the things that you keep in mind when you're trying to make these decisions as a medical doctor.
Well, I can tell you, the first issue, I think, is that mental health catastrophes have reached epidemic proportions in this country. There's a third of the patients that come into the emergency department are on some sort of mind-altering medication, prescribed or otherwise. People are suffering, and so few people are willing to talk about it.
Now that's an interesting statistic there, doctor, because we often hear sometimes on these commercials that there can be an accelerated risk of suicide with some of these mental health drugs. Is there a correlation there?
Absolutely. Also, now you have a little bit more energy, and but you're still frustrated, you're still confused about life, you're still angry at one issue or another. But now you have the energy to do something about it, and a lot of people choose to end their anguish by killing themselves. So one of the reasons we Baker Act people is to remove them from the drugs, from the other instruments of self-destruction, put them in a safer environment. And that's why I find great fault with the military that still leaves these people who may be suffering from all kinds of mental illnesses, schizophrenia, bipolar disease, deep depression, and now they've got a sidearm at their disposal to do something about it. And particularly now, they got automatic weapons to take other people with them to end this confusion and horrible suffering they go through every day.
Scott, you've outlined some problems, one being the continuing debate about the medications utilized, but also really across the spectrum in terms of medicine. We've basically, over the last 3 decades, moved away from institutionalizing so many people who are dealing with mental health issues. There always seems to be a problem in terms of the public purse and also a patient's inclination to try and seek that help. What do we need to do, or if you were to step out of your role in the private sector in emergency medicine, if you were advising the Veterans Administration and the VA hospital system, what should they do? Should there be a priority on military mental health facilities institutionalization?
I think everyone needs to be encouraged to discuss their mental health issues. If you feel bad, you have to have somebody to talk to about it. There should be something. The military has the best opportunity because they can tell their soldiers what to do. They say you have to be restricted to your barracks there or seek counseling on a regular basis, for 6 weeks, 2 months, whatever it takes, until we think you're stable to get back into in the service. I talked with John before. We mentioned on this program, you are only as sick as your secrets. And it's a tendency in this country to try and pretend you're happy. Happiness is an illusion, and you're not willing to share with the fact that I am miserable. I'm confused. I don't feel like getting up. I'm playing a game. I'm putting on a mask every day. And this is such a great opportunity to use this catastrophe to get people to talk about that misery, to talk about the angst, the confusion, the true daily suffering that people go through. It's not just social anxiety disorder. These people don't feel comfortable inside their own skin.
It's a tough spot. Dr. McFarland, you mentioned the need to talk about this. And again, this goes back to what JD was talking about a little bit too. It's not easy for these guys to talk about this stuff. And, things may have changed. What really do you think changed? Because, these soldiers are on base now. They don't have access to their weapons the way they once did. And, we don't have any official statistics, but you don't hear about these types of shootings maybe 25 years ago or 30 years ago or 40 years ago. What do you think has changed that makes the 2009 Fort Hood shooting possible, this Fort Hood shooting possible, the thing last year at the Navy station in Washington, D.C., and there was another recent shooting at a naval yard in Norfolk, Virginia as well. What has changed? Are we just hearing about this? Is it because it's in the media? But why are we hearing about it so much now?
Well, I think I can say 30 years ago, I've been practicing emergency medicine for 30 years. 30 years ago, teenagers didn't come into our emergency department on antidepressants. There is such a prolific use of mind-altering drugs, theoretically, to enhance people's self-esteem, and their confidence. I don't know if the people involved in all these shootings were on medication, but who knows the side effects of these multiple drugs? Are we taking somebody who's miserable and turning them into a monster? I don't have that answer, but I do know that it's an unusual preponderance of mind-altering drugs.
Dr. McFarland, we're going to have to leave it right there. We appreciate your insights. Andy, we thank you.
Thank
Coming
you.
back, we're going to hear from you. Don't go away. There's more to come on America's